I want to call out Craig Kelly for his tremendous work and using his ability as a politician to try to get this message out. He has been suppressed, he has been attacked, but I got to tell you, he's on the right side of history and he's on the right side of science. And so he has my undying support. Hi, my name is Dr. Pierre, Kory, and I'm the President and Chief Medical Officer of the Frontline COVID-19 Critical Care Alliance. We're a nonprofit organization here in the United States whose sole mission since the beginning was just try to figure out how to treat this disease and develop the most effective treatment protocols that we could. And we have done that. We have early treatment, we have hospital, and we even have long haul protocols, and they have been highly effective. But the problem is many of the components of our protocols involve generic repurposed medicines. And there is a huge disinformation campaign that's suppressing the knowledge of efficacy of those medicines. I've been transformed as a physician in this fight. I never knew how corrupt and how powerful the forces of censorship and propaganda were in suppressing this information. And I want to call out Craig Kelly for his tremendous work and using his ability as a politician to try to get this message out. He has been suppressed, he has been attacked, but I got to tell you, he's on the right side of history and he's on the right side of science. And so he has my undying support. In all these advanced health economies around the world, the media, the health agencies, and particularly the medical journals keep sending out messages which are unfortunately not true. They're not scientific. They are trying to establish a narrative against the use of generic drugs. And that is all in the service of the pharmaceutical industry. What I have seen and what I've learned in my medical career in the last 2 years is absolutely, it's been transformative and not in a good way. I almost feel broken by this knowledge, but I do not trust any sort of publications when they talk about repurposed medicines. We know these medicines work. Our protocols have gone around the world. We know they've saved hundreds of thousands, if not millions. Many of the countries, many of the different health ministries that have employed early treatment, you see massive reductions in hospitalizations and deaths, yet this knowledge is being suppressed. And these mandates and all these policies, they weren't scientific. The general public health community knew before a pandemic broke out that generalized lockdowns didn't work. What did they do? They proceeded to lock down. And I hate even imagining why they did that, why they violated and departed from the science so much. But that's what I've seen, especially around the use of repurposed drugs. Again, they've departed from the science. And then this obsessive, monolithic, globally vaccinate everyone against a coronavirus, which highly mutates, has been a catastrophic and humanitarian disaster. I was hoping that they wouldn't be. I wanted, like everyone else, for them to solve the pandemic and do so safely, but it's the opposite that has happened. However, you don't hear about it. We're constantly being told that they're safe and effective, and the only way out of this pandemic is to vaccinate. That's not true. They have failed, and no one hears about it. And it is terrifying. The absolute depraved and sinister use of propaganda and censorship. And by the way, if you haven't been censored, you don't know what's being censored. Everything my organization is about, we are 5 physicians who just use the evidence, use the science, used our deepening knowledge of the disease and the therapeutics. All we want to do is put out protocols. We've been attacked, we've been deplatformed, we've been ridiculed in the press, and we are some of the most highly published physicians in our specialty. And so I have to tell you, we're in the fight for our lives, and we need good people willing to use pragmatic, sound, data-driven, objective evidence and guidance. And I think Craig Kelly has spoken most for that. He's seen that and how much it's departed from all of those qualities. And so I just want to put out this message to support him, and thanks for listening.